Good evening. My name is Alexis Taylor, and I'll be sharing with you what I know about the APGAR score. The APGAR score is an assessment conducted by the nurse a minute immediately after the child is born. The newborn is conducted on activity, pulse, grimace, appearance, and respiration. It's also conducted as heart rate, respiratory effort, muscle tone, reflex irritability, and skin color. The APGAR score determines to the nurse whether or not the baby needs medical intervention or not. 7 or above means good, and 7 or below means bad based off the score. Since there are 5 categories within the APGAR score, each category is scored out of 2 points. To determine whether or not the baby gets a score of 2 in each section, the following has to apply. The heart rate or pulse has to be at least above 100 beats per second. Below scores a 1 and none scores a 0. Activity, if the baby is constantly moving, that scores a 2. Some movement a 1 and completely limp scores a 0. For an infant to score a 2 on grimace, it has to be either actively pulling away coughing or sneezing from suctioning. Some grimace scores a 1 and no response to the suctioning scores a 0. For appearance or skin color, the baby has to score a 2 if it has good color all over, which means a nice pink hue to the skin. It scores a 1 if it's bluish hands and feet, and if it's a bluish gray all over, it scores a 0. And for respiration, the baby has to score a 2 if it has a strong cry, a 1 if it's whimpering somewhat, or a 0 if it's making no sound at all. Once the nurse determines that the baby is of above average and is in good health without any medical intervention, she will go on to do a small physical and check the umbilical cord to make sure there will be no kidney problems in the future and the baby is cleared to go. And this is what I know about the APGAR score. Thank you for watching.